Hello, dear doctor. Hello, dear doctor. Everyone hearing, please, anyone a response? Hello, dear doctor. Today I am discussing MRCPCS Part 2 exam, that means AKP. Our courses is uh, is much important. After discussing it, we will find more essential resources and topics which is easily for to pass MRCP CS Part 2 exam first time. Uh, our class is musculoskeletal system. And we follow the our class is this book, this book. This is the book Applied Knowledge in MRCP Pediatrics in MRCP Master Course. This is the RCPCS recommended book to prepare the MRCPCS Part 2 exam. Let us start it. This is our slide. First of all, MRCPCS brief musculoskeletal disorder. This is the syllabus of MRCPCS Part 2 exam, that means AKP. Applied knowledge in we follow these books. This is the recommended book for MRCPCS Part 2 exam. Mm, mm. Recently, MRCPCS Part 2 exam AKP changes to their question pattern. That means 100 question, 60 question in morning, 60 question in evening, best of 5. Some of our students asking which topics I follow the part 2 exam. This is the clear idea of the mainly in exam you tested short history, clinics with image, X-ray data with ECG, evidence-based medicine. Let us start it. This is the RCPCS syllabus. This is more important for MRCPCS part 2 exam. The percentage of question in musculoskeletal system in part 2 exam, AKP, 8 to 17%. Most important. This is the syllabus of AKP to able to assess the diagnose and manage musculoskeletal disorder in systemic computer. This is the syllabus. Um, Step 1. Systemic protocols. Yes. In AKP book, first of all, we discuss the most important to MRCPCHAKP exam is development dysplasia of the hip, that means DDS. This is the 5-step question. In every years of exam, we can find this topic question. You also read from the pediatric guideline DDS. DDS means is a disorder of the hip which can be present with born or become apparently first few months of life. This is present in commonly in at birth. Most important is risk factor. Baby with presented presentation, family history of female infant, positive family history, oligohydramine. This is the another importance. Scanning is after birth. We do the is two clinical examination, Barlow test or Tollenius test, and another test is if risk factor ultrasonography of the hip. Most presented with the baby is 6 to 6 months. 6 to 6 months. Remember it. 6 to 6 months. Baby presented an equal gluteal fold, unequal limb line, inability to fully abduct the hip. This is the image. Barlow test. This is the importance. Barlow test. How can do it? Barlow test. Downward pressure through femur in exerted if the hip dislocated. Then height of the femur is felt to move of the acetabulum. Another test we do in during scanning or Tulini test, if the hip cannot be dislocated, then attempt in the relocate the head of the back in acetabulum. This time is this is the Barlow test. This is the Otolini test. This is another most important is if you present with development disorder at birth or 6 months of age. First of do what investigation we will do? First of all, ultrasonography of the hip joint. Ultrasonography of the hip joint in first 6 months. After 6 months, it will the extra abdomen. Right in this first 6 months, 6 months we do USG of hip. If more than 6 months, do extra. This is the very much important for exam. In question, you will find, remember it, if baby is below less than 6 months, then ultrasonography more than 6 months, ultrasonography extra few. This is the extra most important 8-year-old later presentation of development disability if treatment. First of all, treatment of the development disability is most important is pelvic helmus. Double maybe pelvic helmus. Double maybe pelvic helmus. In older age, a specialist intervention is needed. What is the complication of DDS? Anyone can tell me? Most important necrosis, avascular necrosis of the femoral head. What is pelvic test? In I am showing this pelvic pelvic humness. This is the pelvic humness. This image the humness. This is the first off. It in MRCPCHAKP question. I also know the one question is of this DDS. What the recall? X-ray of Fourier girl on wheelchair developmentally displaced because irritable, then left at what is the diagnosis? This is the X-ray. We'll find this. This Fourier superior. What is the diagnosis? This look at the tip. Look at the tip. Also, you find this question in absolutely free in this website mrcpchsfree.com. After registering you uh, to find out this in my confess. My confess AKP. This is recall. In this session, we will practice all the recall in musculoskeletal system in any other software system. We can do this practice. Let us start it. First up question. Development discussion of the is most important investigation. Treatment ultrasound. Yes, this is the first of all. We can also explanation. Next. Also, less than 6 month ultrasound. X-ray pelvis more than 6 months. This question and after that you will find result with progress. Yes, you will find all the question in this. This is the most important for MRCPCS exam. And we will do another topics. First of all, anyone? Yes, this is the X-ray. X-ray question. Copy. Did everyone this question in the chat box and comment anyone the answer. I am also provide the recent recall question of uh, these topics also consistent. This the another topics is purchase disease. This is the most important for us. This is the also five-star topics. Also important in MRCPCS purchase disease. What are the difference between DDS and purchase disease? Purchase disease is a rare blood supply to the heart of the humerus femur displaces hormone. This is the important. Height of femur become completely or partially male. Listen, usually 4 to 10 months of age. Usually in only boy. You see this. This is femoral head. This is femoral head. Childhood first disease presented with pain in groin, hip, thigh, or knee, especially after exercise. Most important. This is the most important. Pain occurs in after exercise, lameness, stiffness, and restricted movement. Vaccine and ointment. What are the investigation will do? Extra hip joint showing mill-shaped head of the femur. Treatment is regular physiotherapy along with trust. This is the most important topics. This is the another five-star topics. Sleep femoral epiphysis five-star. This is the you can find one question from these three topics. In a diagram, you ask question. Sleep femoral capital epiphysis describe abnormality of the hip that classically affect the ace. Remember it, ace. Femoral head is displaced from the neck of the femur in symptom acute or chronic development. This is the most important. This obese person. This is the obese person. Obesity is most important. Extra of the whole displace of the human head. This is female. First of all, you will see age 11 to 60 years. Female body obesity, pain in the hip joint. Diagnosis is sleep femoral capital efficacy. Most of the X-ray. Management, admission, complete bed rest, orthopedic surgery is flexion of the head. This is the another question. A 5-year-old obese with autism disability after 6 months of still lameness, no pain. What is the diagnosis? Supine. This is another exam question. Sleep apparent permanent processes, especially discussion. A 5-year-old is diagnosis. This is another topic. This is the extra case 79. Read this. A 9-month-old boy has been noticed asymmetrically increase with limb length discrimination. This is the limb discrimination. What is the plain extra of the shown? The diagnosis. This is the extra of femoral display support and upward capital number of femoral epiphysis. DCS, this is the right side of the DDS. Yes, so this DDS. Family history of disease is important. This is the important this presentation. Another in X-ray anomaly. 46 is ultrasound for the investigation of size. Investigation is DDS ultrasound. Incidents, you write this book. Then another important is the ultrasound of the head. And this X-ray is important. Ultrasound it's important. You read this from these books. This book is important for MRCP CS Part 2 exam. Mainly is X-ray or investigation. X-ray, ultrasound, CT scan. This is the good books. That is the another books. MRCPCS Part 2 question and answer of the answer for the new format. There is many question. You can practice these types of questions. This is the another RCPCS 50 cases. This is the important also. And then you will go to another topics is another one. I am discussing more important topics first, then new topic. It's the acute and chronic arthritis. Most common causes arthritis means inflammation of the joint, usually with pain and swelling of the affected joint. Most common is bacterial pneumonia, viral lung disorder. Other J, not important. So this is the five important triester. This is the triester topics. Septic arthritis. Septic arthritis. Septic arthritis mostly occurs in under 2 years of age, usually in single then affecting commonly the hematogenous feed. This is the important most common organism is Staphylococcus, also Streptococcus. In septic arthritis, present with pain, restricted movement, swelling, and redness, common feature. Always remember, in septic arthritis patient, always present is stimula unwell. That means pyrexia. This is the important neutral position. Important due to pain. Arzen, this is the another important topics for exam. Arzen orthopedics opinion to escape the joint plate expression. What are the investigation for septic arthritis? Joint fluid aspiration. First of all, joint fluid aspiration. Joint fluid aspiration. Treatment, it's culture sensitive, flow oxygen and septic exam. Transform. This is the most important for is reactive arthritis. Reactive arthritis is another most important 5-star topics for MRCP CS AKP exam. In this exam, the swelling triggered by the infection of the influenza normally patient with after diarrhea, Salmonella, Shigella, Campylobacter, also sexually transmitted disease, chlamydia. Consider is urinary tract infection or uveitis. Done. Most common. This is the most very much important. Say reactive artery most vulnerable SLI B27. SLI B27 patient always present with so most common site is hip joint. Then the treatment is when is ibuprofen no problem. Yes, this is the recall question. A fever whole bed presented 10 days after him of respiratory infection with neck pain. Is it? No, fever. Is that no? This is the infinite tester. This is the infinite tester. J. Yeah. J is a umbrella term which is chronic associated with 16-year-old sickness 6 months. Suspected pediatric hematologist always confirm the reviews. Travel disease another important.